Delayed cord clamping has so many benefits for babies, and the reason being, when baby is born, this placenta is still pushing and pumping blood through this cord into your baby. And actually what happens is if you immediately cut and clamp that cord, all of this blood that's left in the cord is your baby's blood. And think about it that way, that if we immediately cut and clamp the cord, all the blood that's left within this cord is left behind. And it's almost like taking away about 100 mils of blood from your baby, because it's your baby's blood. It's not your blood, it's not the placenta's blood, it's your baby's blood. And so by immediately cutting and clamping, you are decreasing the amount of blood volume that is in baby. So let's take a look at the evidence. So I'm going to highlight 3 different evidence-based articles and reports that you can go and read. These are open access, go onto Google, you can search them, have a look at the authors' names and the titles and have a look yourself. You also have the Royal College of Obstetricians and Gynecologists statement too. We also have the Resuscitation Council UK guidelines as well for resuscitating babies attached to a cord. And then this is a really good systematic review as well that you can go and check out. This is the most recent one as well. Now in preterm babies, delayed cord clamping is literally life-saving. It improves mortality by 1/3. Really, really beneficial, and almost all units should be undertaking delayed cord clamping with preterm babies and undertaking skills and drills and regular training through their neonatal life support guidelines with their paediatric teams and with their midwifery nursing teams as well. At 1 year old, babies who have delayed cord clamping of at least 1 minute, okay, we're not talking about optimal cord clamping here, which is where you wait until the cord completely goes white, but having at least 1 minute of delayed cord clamping improves iron stores at 6 months old and at a year of age as well. It's also been found to have lower circulating lead levels as well in areas where women are having babies with high air pollution too. It also improves serum ferritin levels and also helps with fine motor skills at 6 months old. For babies who are born prematurely, it also decreases the need for a blood transfusion too. Now, one of the challenges to resuscitating attached to the cord is the equipment. For example, resuscitators tend to be a big unit in the corner of a room. Not many units have a bedside resuscitator trolley that can be brought to it. However, what you can do is bring the resuscitator closer, and if you're able to, from a manual handling perspective, and the woman's not bleeding heavily, you can actually perform that resuscitation in between mum's legs. And it's something that's taught to community midwives, for example, because actually to resuscitate a baby, this is giving baby oxygen and blood, whilst you're also delivering oxygen via a mask if the baby requires resuscitation, for example. And so actually that baby is getting twice the amount of oxygen, which is really beneficial for them. The challenge on hospital beds is that actually the mattresses are quite soft and squishy, and trying to get that baby into a neutral position to be able to perform resuscitation, plus actually getting you into an optimal position to provide that resuscitation can be quite challenging. It is possible, but it often requires a lot of multidisciplinary teamwork, lots of communication ahead of time, and usually undertaking skills and drills regularly as well. Not all units are on board with that. It's a training thing that is coming in, but let's look at the resus guidelines. Now, the resus guidelines in the UK recommend that as long as no resuscitation is needed, at least 60 seconds should be provided to all babies to have delayed cord clamping, and that clamping should ideally take place after the lungs are aerated. Now, if you can maintain the warmth for that baby, then initial resuscitation interventions can happen whilst attached to the cord. So as long as you can actually maintain that resuscitation effort, as long as that baby's kept warm, there is no need to actually cut and clamp the cord. You can keep that baby attached to the cord whilst performing resuscitation. As I've said, the challenges are the equipment elements and the fact that not all units have these bedside resuscitators currently. So to answer your question, yes, delayed cord clamping is really beneficial for babies, and the longer that cord can stay attached for, as long as the safety of both mum and baby are paramount to that, yes, it's really beneficial and should be standard for all care.